start on time on behalf of the team because there's a packed agenda. And as I've mentioned to a couple of you, I'm sort of pretending this is a large living room. And we're all friends here. Some of us know each other already, and some of us don't. Just take a deep breath. So, I'm Leisher. I am the co-director of the University of Utah Stillbirth Center of Excellence. We call it USCO. I'm also a stillbirth epidemiologist, and I'm a global stillbirth advocate, but most importantly, I'm the mother to Wilder Daniel, my first child, who is stillborn at 30.5 weeks in 1999 with no cause found. And so Wilder is the reason that I am here today. It's funny. For the parents in the room, you understand, and for the caregivers in the room, you also understand how sometimes even 26 years later, and it's getting me right now. Anyway, on behalf of my amazing co-director, Dr. Bob Silver, who isn't with us right now because he is delivering a baby, a rainbow baby, and also on behalf of our wonderful team at USCO, I am honored and thrilled to welcome you all to the second annual Stillbirth Symposium, Closing the Gaps. USCO's mission is to be a national and a global leader in the fight to end preventable stillbirths, delivering excellence in clinical care, bereavement support, research, advocacy, education, and yes, equity in health outcomes. We see today's symposium as an integral part of that mission, bringing together clinicians, parents, policymakers, researchers, and other stillbirth stakeholders and allies, very much in the tradition of the International Stillbirth Alliance, for those who know ISA, for this day of learning. Today, our day is focused mainly on moving towards a stillbirth bereavement care pathway with equality and equity. It's my honor to offer our heartfelt thanks to the generous donors and sponsors who have made today's gathering possible. Your support has helped to create this space of remembrance, healing, and advancement in bereavement care. A special thank you to the Mower family, whose meaningful gift is given in loving memory of Riker Mulholland. And to the Stetler family, whose generosity and fellowship we greatly appreciate. We also extend our thanks to our corporate sponsors, Young Living, Cozy Earth, the Grand America Hotel, and Larkin Mortuary. To all our sponsors, your contributions are acts of care and love, and we are deeply grateful. Next, I'd like to acknowledge two aspects of my own identity that affect my work on stillbirth, and hence my role in today's symposium. First, as a white person, I acknowledge that I am inherently part of the white-dominated society that created and perpetuates the very structural racism that is part of the inequities we will be learning about and discussing today. And secondly, as the mother of a stillborn baby, I unfortunately bring an insider's perspective to stillbirth. I'd also like to share a disclaimer that the opinions expressed during today's Stillbirth Symposium by University of Utah employees are their own. With that said, I'm now glad to provide a land acknowledgement. The University of Utah has both historical and contemporary relationships with indigenous peoples. Given that the Salt Lake Valley has always been a gathering place for indigenous peoples, we acknowledge that this land, which is named for the Ute tribe, is the traditional and ancestral homelands of the Shoshone, Paiute, Goshute, and Ute tribes, and is a crossroads for indigenous peoples. The University of Utah recognizes the enduring relationships between many indigenous peoples and their traditional homelands. We are grateful for the territory upon which we gather today. We respect Utah's indigenous peoples, the original stewards of this land, and we value the sovereign relationships that exist between tribal governments, state governments, and the federal government. Today, approximately 60,000 American Indian and Alaska Native people live in Utah. As a state institution, the University of Utah is committed to serving Native communities throughout the state in partnership with Native nations and our urban Indian communities through research, education, and community outreach. So you should all hopefully have a program. See that? Yeah. And you can see that it's a super packed agenda. So to respect the time of our presenters and also our own time, we're going to do our best to keep to the allotted time and keep moving forward. If you find that you have questions or comments that are remaining unanswered, please just check in with us at breaks or afterwards. We will have a short break for coffee in the morning and afternoon with a longer break for lunch. Today's symposium ends at 5 p.m., following which we will have time for networking before our series of evening workshops beginning at 5:30 with a simple dinner for those who have registered. So a bit of housekeeping. The bathrooms are outside and to the right. There's a lactation room also outside and to the right. I think it's room 1640. Yeah. And we have a quiet room that's sort of set aside for parents, family members, support people. If you find it to be that you need to step out for any reason, please feel free to use that room. It's outside to the right, all the way at the end of the hall on the left, past the university store. Let's see. I can't hold the mic and turn the page at the same time. Should have thought of that before. So yeah, and also finally, many organizations have brought things to share that are outside on some of the round tables. So please, during the breaks, go and have a look and see what you find there. I want to also acknowledge that we will be having some photos of stillborn babies throughout the day up on the screen. We will let you know when those come up, before those come up, in case you need to look away or step out. So with that, I think I've covered everything. Everybody should have a program. You should have one of the votive candles. Sorry. Okay. Yeah, go ahead and hold it up. Yeah, that's what you should have. So maybe folks like Ashley, you guys can run outside now and bring in some of the other ones, and we can hand them out to whoever wants one and doesn't have one. You should have a program and a name tag. That's it. So with that, I'm going to hand it over to Stacey Fletcher. Stacey is the program manager for Parent Voice at the University of Utah Stillbirth Center of Excellence, and she's an absolutely vital part of the work that we do, and she's going to lead us in the next session. Thanks, Stacey is the program manager for Parent Voice at the University of Utah Stillbirth Center of Excellence, and she's an absolutely vital part of the work that we do, and she's going to lead us in the next session. Thanks.
I'm a podium girl. Is this working? Yeah? Okay. Oh, here's your mic.
Not sure.
Is that working? Ah, that's better. Okay. My name is Stacey Fletcher, and I have the honor of working at the Utah Stillbirth Center of Excellence as the program manager of Parent Voice. My son Benjamin was stillborn 19 years ago. My job is to speak about and advocate for lived experience in this important work. I work as peer support in the Utah Pregnancy After Loss Clinic. It's an honor to support our clinic families who are on a terrifying and hopeful journey through pregnancy after loss. After the U.S. Pregnancy After Loss Network, our clinic is the third in the country to provide this amazing care. Our network has 6 additional clinics in the process of opening across the country: UCSF, UCLA, Yale, Penn State, the University of Hawaii, and Intermountain Health, another clinic here in Utah. This network will both save and change lives. At the University of Utah, I am part of a parent clinical training team to instruct clinicians and staff members about this pregnancy after loss model of care. I also get to share the experiences of many parents whose babies have died during pregnancy or shortly after birth. I have the honor to tell their stories and help improve care for the many parents in the future who will unfortunately join us as bereaved parents. Under the U.S. PAL network, I'll be visiting these clinic sites and deliver training to rooms of physicians, nurses, MAs, sonographers, researchers, reception staff, scheduling centers, social workers, chaplains, medical students, residents, mental health professionals, and parents. It is one of the greatest honors of my life. I think of the time so many years ago that I spent with little Benjamin and the gift of his life, the life that changed the trajectory of my own. Never would I have believed in that moment that I would be standing here before you today. Over the years, I have sat with many families who were just beginning on their own journey, on an unexpected road of grief. I've been invited into the most vulnerable and sacred experiences with these babies and families. It's a treacherous journey with so much sadness, deep grief, and unexpected gifts along the way. The days and years following the death of a baby can be very dark. When sparks of light begin to return, they often come with both hope and fear. The light is a lifeline to bereaved parents. It is a memory of our babies who we carry in our hearts. Today, I want to honor this light and remember the reason that we're gathered here today, the babies who left us too soon. One of my favorite quotes is this: "I will never forget those who came with a lamp when I was in the dark, not to fix me, just to sit beside me until I could see again." That is our role in this work. We have the opportunity to bring light to grieving parents, to new research, to advocacy and awareness, to education and training, to inclusion and marginalization, and to exceptional clinical care. Our light pierces the darkness, but many lights shine a pathway of change and equity. We do not have a long time this morning, but there's power in a room full of people gathered for a cause. We want you to know who is in the symposium today. We will provide a microphone for you, Sue. It's going to start. We're going to provide a microphone for you to tell us your name, your position in your work, and if you're a bereaved parent, family member, or friend and would like to share, to say the name of the baby that you represent here today. We then invite you to light the candle that you were given when you entered today. If you did not receive one, please raise your hands. I think we've got, there's a couple here. We hope you leave enlightened, challenged, and motivated. It is our honor to share this space with you. I light my candle. For my two babies, Lee and Benjamin Fletcher. Should we start in the back?
Okay. Hi, everyone. I'll keep this short and sweet so we can get through with introductions like Stacey mentioned. My name is Susannah. I'm a senior research manager in the OB department here at the University of Utah. I'm a lost mom.
Hi, my name is Brittany Crystal. I'm the founder of the Iris Fund, mother of Iris, who is still my stillborn baby. She is 8 and a founding partner of the UPAL network.
My name is Kevin Yost, and I'm a fourth-year medical student going into obstetrics and gynecology next year.
My name is Guadalupe Aguilera, and I'm a postdoctoral researcher at the University of Wisconsin-Madison, and I am a sister to Maria and aunt to Sophia.
I'm Kim Coates. I'm a clinical leader at my hospital in the OB department, and I am a lost mom.
My name is Jen Zaga. I am a birth and postpartum doula.
My name is Joey Morgan, and I'm also a birth and postpartum doula.
Excuse me, my name is Hannah Milstein, and I'm a social worker in women's health, and I'm a lost mom too.
I'm Taylor. I'm also a social worker specializing in women's health.
I'm Jasper Moss. I'm also a social worker in women's health.
If you guys want to light your candles when you introduce yourselves, we'll keep them lit.
Diana Aguilera, I'm a social worker in women's health.
Missy Bradshaw, I'm a NICU nurse at Women Regional. I also work with Angel Watch and I'm a bereavement specialist, and I'm a lost mom also.
My name is Jessica Babbitt. I'm a physician assistant at HMHI, working in the perinatal mental health team. I'm Lee Fletcher. I'm sibling to Benjamin and Lee Fletcher.
My name is Millie Fletcher, and I'm sibling to Benjamin and Lee Fletcher.
And I'm Zan Leisher, and at the University of Utah, and I'm the mother of Wilder Dan.
I'm Jamie Bates, and I am the mother to James, who turned 16 this week.
I'm Melanie Green, and I light my candle in honor of my sons, William and Maximus. We will live life to the max.
I'm Dale Thompson. I work for OBGYN and lots of contracts.
Say y'all, Mom, I'm a researcher in stillbirth here in OBGYN.
I'm Jessica Clayton. I am a lactation consultant here at the University of Utah, and I'm here in honor of Eliza Pitt.
Stacey Breeze, women and newborn research representative.
Kathy Meadows, research nurse with Intermountain Health in Women and Newborn.
Deanna Magana at McKay Hospital, Women and Newborn Research.
I'm Sandy Dillerman. I'm MFN research at McKay Hospital.
Kristen Orton, a NICU nurse at Women and Newborn Research at
Rachel Moore. I'm a research coordinator at Utah Valley Hospital. Nicole Sherman. I'm a labor and delivery nurse and bereavement coordinator at IMC.
Adrienne Morrow, a marriage and family therapist specializing in perinatal mental health at Tanner Clinic.
I'm Cindy Bray, just moved to Utah now, so labor delivery nurse. Raquel Alfaro, I'm a doula and postpartum doula. Lighting my candles today for Timber Barker and Samantha Alfaro. Robin Carter, birth and postpartum doula, and I light my candle for my granddaughter Elizabeth.
Meredith Ashton. I'm a birth and postpartum doula, and I'm lighting my candle for Ella Wyrick, my best friend's girl.
I'm Caitlin Winston, and I'm a birth and postpartum doula as well, and I'm lighting my candle for baby August.
I'm Stacey Hamilton, and I'm a labor and delivery postpartum doula.
I'm Morgan Ship, and I'm a student midwife.
I'm Brianna Hazelwood, and I'm a licensed direct entry midwife and volunteer on the infant mortality review.
My name is Kara Leonard, and
I'm Amy Salzman. I'm an epidemiologist with the Utah Department of Health and Human Services and also a LOSCOM.
I'm Heidi Sylvester. I'm a midwife working in the Department of Health and Human Services, and I'm aunt to Matthew.
I'm Susannah Smith. I'm Utah's
perinatal mortality review coordinator.
Anyway, that's it.
I'm Danielle Larson. I'm also with the Department of Health and Human Services. I'm the data manager for the Utah Solar Survey.
I'm Jane Rollins. I'm the Share Parents of Utah that provides pregnancy and infant loss support, and I am the mother of Garrett.
I'm Sarah Henderson. I'm also a Share Parents of Utah. I'm the mother of Carolyn and Linda.
I'm Vicki Angelich, and I'm with the Utah Department of Health and Human Services.
I'm Melissa Anderson, and I'm with Larkin Mortuary.
I'm Jalen Olson. I'm a licensed clinical social worker, former director of Angel Watch, and currently in private practice with perinatal loss and grief.
I'm Carolina Barra. I'm working in parental care, and I'm the executive director.
I'm Natasha Pond, and I am a doula.
I'm Leanne Johnston, and I'm one of the team members in the OB/GYN department working on
Ashley Joseph, I'm a clinical research coordinator with the University.
I'm Sarah Lopez. I'm sure you all have met me at some point via email, but I run the Stillbirth Center of Excellence Research Program.
My name is Kathleen Mossman. I'm a perinatal bereavement specialist and clinical counselor and bereaved mother to Jacob, Amadea, and Ryan.
I'm Jessica. Coordinator here at the
My name is Emily Riches, and I'm a researcher up here at the
My name is Haley Critchfield, and I'm a birth and postpartum doula.
My name is Lauren Davis, and I am a birth, bereavement, and postpartum doula, and a lost mom as well. Today I'm lighting my candle for my own babies and for Lemon Poppy.
I'm Joy Capsis, nursing manager over at University of Utah Outpatient Clinics.
Hi, my name's Aubrey Rasmussen, and I am a nurse here in Women's Health and the bereavement coordinator at the
Hi everyone, I'm Kathy Schreiber. I'm the hospital chaplain at the University of Utah Hospital that oversees the women's and children's areas.
I'm Stacey Fletcher,
I'm Finley Knowles,
and I am a parent, a bereavement and parent support specialist.
I'm Teddy Palmer. I am also a lost mom to Ethan and a bereavement specialist.
And I'm Ashley Home, bereavement support specialist for Mount Health in Utah County, and I light my candle for my son, Kingston.
Good morning. I'm Astrid Woodward, a former L&D nurse, current internal medicine nurse with the Pregnancy After Loss Clinic, and I light my candle in honor of all of the stillborn births I've attended.
I'm Stephanie Sanchez. I'm the nurse manager of the Maternal Fetal Medicine Clinic at the U, and I light my candle for my baby.
I'm Brenda Gulliver. I'm a previous labor and delivery nurse and work clinical programs, specifically the UPAL clinic here at the University of Utah. And I light my candle for all of us. Thank you so much, everyone.
Thank you. What a beautiful room full of people, right? We do have a few minutes, and so we talked about asking, we would love to have a researcher better share their story of the research that they're working on or research that they would like to have done. We'd love to have a parent share their story a little bit more in more detail of what brings them here today. We have a room full of doulas, and that's really cool, doulas and midwives. And so if you have a story that you would like to share, a little bit longer, we would love to hear from your profession and also your life experience a little bit more in detail, what brings you to this room with us today. Is there anyone that would like to be brave? We're going to be vulnerable today, people, so just put your hands up. You better buckle up because this is going to be a good day. Anyone? Do I have a researcher that will share some of what they're working on? Research is my jam, and it's my favorite meeting I attend.
Do I need a microphone?
Yes. Oh, that's me.
So again, I'm Kathy Meadows. I work with Intermountain Health, and we are currently doing a we call a prospective stillbirth study, where we are collecting surveys from moms about their loss, their knowledge about options available to perhaps identify risks or reasons for their loss. We're also collecting biospecimens to be stored for future research. If something is maybe found to be a commonality, we will have those samples, a large bank of samples, which is not currently available, to utilize to hopefully help decrease the stillbirth rate and help other women who hopefully do not have to go through that loss.
Amazing. Okay, who's going to be next? I'd love to get 5 people if we can get some people to share. Jane. Run, say run.
I'll start loud.
Okay.
I'm Jane Rollins. I gave birth to my son in May of 2020, right in the midst of COVID. Love that. It was a full-term stillbirth at 39 weeks to trisomy 13, genetic condition, not viable with life. After that, I got connected with Shared Parents of Utah, a bereavement organization that came to my delivery and provided mementos and photos and took hand molds and foot molds of my baby. And just, it was another lost mom who came and supported me, and that peer-to-peer support was invaluable for me. Several months later, I started volunteering with that organization as another peer-to-peer support. We offered not group therapy, support groups, and different events and workshops, activities, online Facebook groups, and eventually I also became what's called a hospital companion, where I went to births after loss, and now I provide the molds and the photos and the memorabilia, and I have the opportunity and honor to go sit in spaces with families of grief and able to be with them. And we provide, Shared Parents of Utah provides that to any family in the area who has losses. We love to be reached out to by hospitals, by midwives and doulas and home births and anything that will come and just serve that as a nonprofit, give that donation service, and connect with any parents who have that loss. That is a privilege and an honor that I've had to sit with families in that space and just connect with these families. And I love that work, and I love not being needed.
Thanks, Jane.
Absolutely, absolutely. sputah.org. More information there. Sorry to plug my own thing.
That's okay. We're going to have anyone that brought tabling or any information, will have it out. So, I mean, the purpose of today is to network and to learn from each other. So, do I have a brave doula in the room that will share a role that you do and why you're here today? Cool.
I don't know if I can stand. Sorry. I didn't think it would get me this hard, but it is. I attended the first stillbirth last July 2024. My very, very sweet client and friend was not alive at 42 weeks. We worked together really hard in labor, and it was tragic to see how it ended, and I believe it's still an open case, so I don't want to speak too much to the details, but I do know that shared parents played a very important role in their healing process. They were very touched by the roles and the companionship during that time, so thank you for what you do. I'm here today because although I'm a trained bereavement doula, I have no idea what I'm doing in that space. And rather than trying to fix or take away the pain, because I do know loss in regards to miscarriage that you don't want to be saved, but it's a fine line with the space that we hold. And so I'm here to learn more and grow my knowledge and expand my capacity a little bit. So thank you.
Thank you. Anyone else? Cool. Okay, everyone in the room, listen up for this resource because she's amazing.
I'm an executive director of Parents for Children. We are a nonprofit organization working with Latino and Hispanic women and parents. And we have a support group in Spanish for mothers and fathers that lost a baby or during the pregnancy. We are the only support group in Spanish here in Utah. We have sessions online and also in person. So when I heard the other moms here, I was thinking of moms that that we are working in the Latino community because the language and the culture is still a barrier for us. And we have a lot of Latino moms outside that they don't have any support. But I'm proud that we have a space for them. So if you know any moms, Latina or Hispanic that speak Spanish, please refer us. Our services are free.
What's it called again?
Parents for Children. I bring some flyers that I would.
You also do home visits, don't you? You do home visits as well?
Yeah, we do home visits.
Amazing resource. She's real cool. I think she was in front here. There's some.
I was writing things down. I just kind of wanted to share a little bit, like as a midwife. When I first started telling people that I was going to go to midwifery school, everybody thinks, they're like, what a beautiful job, like you're so lucky you get to hold babies, and what they don't know is that babies actually hate me because I bother them the second they're born until they're out of my care. And what they also don't understand is that while I get to sit there in some of the most beautiful moments in someone's life, I always also get to sit there and hold space in some of the hardest moments in people's lives when they hit grief that was unimaginable and that they never thought that they were going to have. And I got to experience that pretty early in my midwifery journey of holding space for somebody. And it really opened this door for me to want to continue my education so that I can continue to hold space for people. And we used Shared Parents of Utah for one of the doors that we had. And it was amazing. It provided great support in ways that I couldn't. But I always tell people when they're like, oh, your job is so beautiful and it's so amazing. And I'm like, it is. And it's really, really hard because I'm honored to be in both spaces with parents.
Very cool. Thank you. Anyone else?
Would you like anybody else to go?
I would love to ask Sega if he'll explain his research that he's doing. Is that okay, Sega? Well, like you have no choice because she's coming at you with the microphone, but like Sega is amazing, and I wish you could know of all the research that's happening, and so he's got some cool stuff going.
So I'm Sega Awatano. I'm not a provider. I'm a researcher in maternal fetal medicine in stillbirth, and we have actually a stillbirth study that was mentioned earlier, similar to that. We're trying to enroll families, so both couples, mom and dad, and we want to collect placenta, and we were trying to investigate inherited and mutations that may be responsible for some of the unexplained stillbirth that we see pretty much a quarter to 50% of stillbirth are unexplained. So we're trying to close that gap and do that through whole genome sequencing. So we do need patient participation, and we need quality data, and we want to collect more samples to understand this.
Yeah, his research is amazing. So if you're interested, I mean, can you just give a brief description if you qualify for the study?
Yeah, so we're enrolling basically families who have not received a diagnosis. So excluding, trisomies would be excluded because it's pretty much explaining what happened there. So our study is called Familial and Genetic Determinants of Stillbirth. And I'd love for you to reach out to Sarah.
And Sarah's home number is?
And Stacey as well. So we'd love to.
Probably everyone has my cell number at this point. Yeah, very, very cool research. Can I ask you how many research studies the University of Utah is doing surrounding this right now? Stillbirth.
So Sarah might know a little bit more about that.
Oh, good. Pass Sarah the microphone. She loves this.
So we've had probably 15 studies, 15 to 20 studies now. And so this one I'm talking about is specifically whole genome sequencing to try to identify mutations.
Very cool.
Can you do that sequencing without the placenta?
Yeah, that's a great question. And the reason why we look at the placenta is mainly stillbirth have underlying etiology traces back to the placenta. We would love to sequence the, from autopsy, we'd love to sequence the most of the placenta is actually the part of the baby. And it's easy for families to participate in the scenario. But yeah, it's a great question. We do both.
What week or gestation are we counting?
Yeah, for stillbirth, we're looking at 20 weeks and beyond. We're also trying to understand earlier miscarriages, which can be easily explained by older genetic testing. We're trying to do newer genetic testing to explain some of those that have no diagnosis.
And Sega, you have found pretty significant results with even like the environmental studies that you've done here in Utah, like mapping stillbirth clusters as well in different areas of the state.
Yeah, so we're starting from Utah to try to understand where there's a higher burden of stillbirth by geography. We're trying to understand the socioeconomic disparity aspect of the psychosocial impact of stillbirth, both quantified and intangible consequences, and that's ongoing. And I'd like to talk about that when we have results, and I'm happy to explain more if anybody's interested.
Very cool. Yeah, research. It's I love it. Okay, does anyone else want to share anything while we're here? Yeah. Or ask Sega more questions because he loves it.
So I'm Kathy, hospital chaplain. I want to share a story actually when I was a chaplain over at St. Mark's Hospital. And I was called to my first stillbirth experience. I met with the parents and they wanted to have their baby baptized. And so we set a time and I went into what's called the sacristy, which is the area that's right behind the chapel that has all the cabinets. And I felt at that moment like I was in a dream. I opened up one cabinet, I found this beautiful shell. I opened up another closet kind of cabinet and I found a beautiful stole to wear. Did not belong to me, but there it was. And I found some liturgy that a fellow chaplain had created, maybe the prior year. Beautiful bulletin, which I made copies of. And I met with the parents. What I didn't realize is they were going to also invite their 3 living children, baby siblings, to the ceremony. And they were young kids. But we all formed a circle together. And I held the baby. And I invited one of the siblings to take that beautiful shell and dip it into a bowl of water and pour that water over the baby's head. So it became a family event. And I can still close my eyes and see that circle and the sacred feeling that was in the air and the love of that family. And it really taught me the power of ritual.
Very cool. Love that. Anyone else? All right. Maybe we'll pass it back to you, Zen. Thank you for sharing. It's cool to get greater detail about who's in this room, so I appreciate it. Thanks.